And on behalf of the WAPC Kwara Kogi, and in collaboration with the Pharmaceutical Society of Nigeria, Kwara State Branch, you are warmly welcome this afternoon. The history of World Pharmacists Day dates back to 2009, when it was first celebrated, and it was established by the FIP to mark the anniversary of the founding of FIP. And each year comes with a theme. For 2004, this year, the theme is Pharmacists, Meeting Global Health Needs. And this theme underscores the vital role that we play as pharmacists in addressing global health challenges, from giving access to medications to providing health education and support. We want to believe that this afternoon, our speakers are ready, they are prepared to lead us and give us the way to show us forward. We want to warmly welcome everyone once again. We'll be introducing the speakers very soon, but we want to say that we are kickstarting the program immediately, and others will join us later. Please, we want to employ all participants to please keep mute, and so that there won't be distractions on the platform. All our speakers will be speaking for 15 minutes each. And then at the end of the third lecture, we'll be taking question and answer and discussions. We thank you all for being on the platform today. So straight away, I'm Pharmacist Busayo Elegbede. I'm the Secretary of the Kwara State Kogi, Kwara Kogi WAPC, and the Zonal Coordinator Pharmacovigilance Center, North Central. I'm going to be anchoring the program, and I want to warmly welcome you once again. So we are going to be taking the opening prayer, which is the second stanza of our national anthem. It will be shared on the screen immediately. All right. So that will be the opening prayer, and we want everyone to recite it openly. O God of creation, direct our noble cause, guide our leaders right, help our youth the truth to know, in love and honesty to grow, and living just and truth, great lofty heights attain, to build a nation where peace and justice shall reign. Amen.
Amen.
Thank you very much. We are going to be receiving the chairman of Pharmaceutical Society of Nigeria, Kwara State Branch, in person of Pharmacist Abdul Malik Muhammad Baba, for his welcome address. Pharmacist Malik, over to you.
Maybe.
Is Baba on ground? Professor Oluyola.
I'm not saying. Maybe call him.
Okay.
Call him. I'm not sure. Call him.
All right. So
Let's call him.
when those people are on ground, we'll invite them. So Oluriola, is Baba on the platform? Yes. Okay. So 3 critical areas of pharmacy practice we'll be looking at this afternoon. The first is pharmacist's role in Code Blue. And this topic is going to be taken by Dr. Abdulfatai Ademola Raji. Following after that, we'll be having the second speaker, who is going to be discussing medicine and pharmacy of the future, the UK Pharmacy First initiative. This topic will be handled by pharmacist Sherifat Mohammed Kamal from the United Kingdom. Then the third speaker is going to be enlightening us on pharmacy beyond borders, embracing global best practices for enhanced patient care in Nigeria. And Dr. Mutia Tolubukola Olulawa, PharmD, is going to be doing justice to that topic. Each speaker will speak for 15 minutes. But give me the permission to introduce to us Dr. Abdulfatai Ademola Raji. All right. Dr. Raji is a fellow of the West African Postgraduate College of Pharmacists. He holds a Doctor of Pharmacy degree from Purdue University. He's an alumni of Pharmacy Faculty of Bafemi Awolowo University, Ile-Ife. Ademola work experience cuts across several industries, including healthcare, human performance, consultancy, pharmaceutical, and telecommunications. He is the CEO of Pharmaraj Pharmacy Services that is based in Indianapolis, US, and is the director at Anointed Saints Home Care, LLC. He's a member of several professional organizations, and that includes American Society of Health System Pharmacists, Indiana Pharmacists Alliance, Pharmaceutical Society of Nigeria, and many, many more. He hails from Isenyi in Osun State, in Oyo State, sorry. He's blessed with a lovely wife and children. I want you to join me as we welcome Dr. Abdulfatai Ademola Raji, PharmD, FPC Pharm. He is going to be taking us in pharmacist role in Code Blue. Dr. Raji, over to you.
Thank you very much, sister. I will say my sister because at least we are colleague, pharmacist Musayo Elegbede.
Thank you.
Thanks for the introduction. Thanks for correcting the father from Oyo State, now from Osun State.
Okay.
But I will take that any day. I'm almost from Osun State too. Okay, having said that, I want to start by thanking the organizer of today's program, the West African Postgraduate College of Pharmacists, Kogi and Kwara Zone, and the Kwara State Pharmaceutical Society of Nigeria, Kwara State branch. I think this is a very nice initiative, and I want to thank you again for giving me the opportunity to be one of the presenters. And having said that, I also want to recognize our elders in the house. I know when I was doing the introduction, they did mention that we have a pioneer fellow of the West African Postgraduate College of Pharmacists in the midst. We want to thank them because they're the one that lays the foundation that we are all following. I also want to recognize the chairman of the Kwara State PSN or the chairman of Kogi State PSN. I'm not sure whether they are there. All our elders in the house, our senior colleagues, and distinguished ladies and gentlemen. So today, the topic I want to talk about is the role of pharmacists in Code Blue. So permit me to share my slides. Yeah.
You have the permission. Yeah.
Okay. Can you see it now?
Okay.
Yes, clear.
It's very clear. Okay. So as it's been said, I've been in US for the past 21 years, and I've been practicing in the hospital. Prior to coming to US, I've worked in some other places. But why this topic is just because of the fact that I want to put us in a scenario. Let me see. What's this number? Okay. The introduction has been done, but one thing I want to find out is, I want you people to notice is the fact that even though I'm a pharmacist, I'm I've been practicing hospital pharmacist for over 20 years in the US. I'm also a part of the function that I do perform where I presently work is the fact that I have I'm a BLS instructor. I do teach within the hospital, teach people how to recognize code, how to attend to code to ensure the survival of our client. Because at the end of the day, what we are all doing is to make sure that we take care of our patient, which is our primary responsibilities. Let's imagine there's a scenario where maybe you are in your hospital and maybe you just went to the cafeteria and you were eating and somebody just slumped. What are you going to do as a pharmacist? Imagine there's no doctor around. Maybe there are some nurses. And then are you just going to start shouting or just looking at the person? So those are scenarios I want us to think. Or maybe you have a retail pharmacy and you are attending to one of your customers and the sales girl come and say, look, one person just came in now and slumped. What will be your next reaction? And that's why it's very important for us to make sure that we know what is code blue and why code blue is very important. I know we have a lot of function as pharmacists, and I don't need to tell us that because we all know. But in the US now, code attendance is part of the functions that they expect somebody to perform, whether you are in retail or you're in hospital or whatever setting you are. Because in the retail pharmacy in the US, most retail pharmacy, either CVS, Walmart, or whatever, they are all now giving vaccinations. They are doing immunization. And during the course of doing immunization, there can be any form of reaction. Even though you can call 911, you can call the emergency vehicles to come. But before they come, what do you need to do to ensure the survival of that person? Because if there is a code, if there is a problem or there's an emergency, while you are calling the emergency people to come, you should be able to do something to make sure that you help the client pending the arrival of the emergency team. So I know we all know these are the functions of the pharmacist. And now in the US, some pharmacists in some states, they've allowed them to actually prescribe. And so when you are prescribing, but it's limited, it's state by state. And I think hopefully in Nigeria, over time, we're going to get to that level too. But for every responsibility, for every opportunity comes some responsibility. As fellows, I know we have scaled up our knowledge, but the best we can do is to make sure that we use that knowledge to improve the care within the setting. As a fellow, if you are in an hospital, make sure that you add value. Don't just be a fellow for the sake of being a fellow. Be a fellow that is adding value. You know, if they make you head of a unit, make sure that your own is different. One of our lecturers then in IFA used to tell us that the difference between ordinary and extraordinary is extra. That we should all strive to put extra in whatever we do. Having said that, so what is code blue? Code blue is a term used to describe medical emergency, particularly anyone that is related to cardiac and respiratory arrest. You know, in an hospital, or we have patients like where I work is about 200-bed hospital. Sometimes they come with so many comorbidities, and you can have any client or any patient that can code anytime. So when they code, it will be strange for the hospital to just, because they will announce overhead or use our pager to page that, oh, there is a code blue. But instead of saying code blue, imagine they say, oh, somebody is dying in room something. A lot, that will cause commotion because the patient will hear it, a lot of people, their family will hear it. So I think the idea of code is just just to find a standard way of communicating a kind of a code to everybody. And it's not only code blue, we have other codes too, like code amber for missing person, code red if there's fire, code purple if there's a bomb threat, and code brown if there's an external emergency. So, and this is also another way of representing the code. So there are so many ways of recognizing the codes. When you work within that such a system, you understand what those code means. But more importantly, the reason why we are here today is, what do we expect us to do that is expected as a pharmacist? I can't count how many code I've attended. what normally happens is when the code starts, the person that normally see the code, let's say within the inpatient, is the nurse that is taking care of the patient. When they see that and they realize the patient is not breathing or is not breathing well or it doesn't have pulse or anything, they call a code. When they call a code, so there's a pager that goes round and then there is overhead system that goes round. The hospital was made in such a way that they expected pharmacists to be part of the team, they expect nurses to be there, a medical doctor will be there, somebody from likely somebody from ICU and or an hospitalist. Or so, but the question is, as a pharmacist, when you get there, I know we are experts in medication administration and everything about medication dispensing, handling, and everything. But imagine if you are the first person to reach the client. Are you just going to start giving medication with them? Because at the end of the day, there should be a leader. And in most cases, when there's a code, the leader has to be a medical doctor. We are just there to support, to ensure that the patient receive the best outcome. So, but you won't say just because I'm a pharmacist, I'm just going to concern myself with medication alone. And as a result, the BLS, there's basic life support, which is a program, comes handy because in the hospital now, before you can even be employed, they want you to be BLS certified, ACLS or PALS. And these are different terms used for different degree of certification that is required for you to be able to perform very well. So let's imagine something happens and then there's a code and I got there and there's nobody to do the compression. Even though I'm a pharmacist, I should know how to do the compression. So I should be the first one to start the compression while they're gathering the rest. So what I'm saying is this, you don't need to limit ourselves to medication only. We can serve as a compressor. We can serve as somebody that is operating the defibrillator, or we can also serve as timekeeper or recorder, or even we can serve as somebody who is giving you respiration. So there are so many things we can do that can help us do the best. For you to be able to perform that function very well, if one is BLS or ACLS or PALS certified, it makes it a lot easier. And the essence of today's meeting is to let us know what it takes to become PALS or ACLS or BLS certified. I'm not sure how it works back at home, but I know being a BLS instructor, after this program, I'll discuss at length with Dr. Bello to see if there are ways we can collaborate. There are some online lectures that can be done. And sincerely, they are very nice lectures. And if somebody can attend it, it's going to widen your scope, and then everybody will be better for it. So this is where I work presently, and this is the guideline, roles, and responsibility for doing a code. In the airway, we have people that we call the respiratory technicians. Their own function is when there's a code, they are part of the team that will come. They are the one that will start giving the patient respiratory. I mean, if they need to give oxygen, if they need to start compression, they'll start all that. But while we are doing that, there will be a defibrillator. Somebody needs to man that and stay there and man it. And then, of course, the nurses is going to be the one in charge of IV and IO. So, but you as a pharmacist, because the doctor is going to be the head. So while you are doing all that, while you are attaching everything that you need to attach at the early stage, the doctor will be there, and then they will do the EKG. They will be monitoring the heart rhythm. Let's say the heart rhythm come back and say tachycardia. As a pharmacist, you are expected, even though you might, you are expected to actually be able to read some of these heart rhythms, because what that will do is this: while you are staying with the medication, you'll be able to know what to take. You can even start mixing those medications before they request for it. But one good thing about this is this: you don't need to cram anything. What you need to know is just there's a guideline, and in the code card we have what they call a code card that contains all the suggested medication that they think will be needed and every other materials or supplies that they think they will need. So what a pharmacist needs to do is to familiarize with themselves so that when they start a code, maybe they will start with epinephrine. After 2 minutes, if there's no change, they can give another epinephrine. After another 2 minutes, they can go to amiodarone. But there are ways to go through it. So if somebody has gone through the BLS, which is the basic life support, we will be able to preempt. So it's not that when they say bring it that you're now going to start drawing it up. You will have drawn it up. If they give 300 milligrams of amiodarone now, the next one is going to be 150 milligrams of amiodarone. So, and that is why my advice to all of us is to just try and see that we are BLS certified. as I've said, I don't know how it operates back at home, but I know our hospitals, we also have a procedure for doing it. And a cost like this will actually expose us. This is a code card that we have in our own place. If you look at, there are so many drawers, because apart from medication, you need something to intubate, you need something to suction, you need something to do a lot of things. So, but the pharmacist in our own place is drawer 3. In drawer 3. In another place, it might be drawer 1. In another place, but what they want us to do is to familiarize ourselves with everything. So that in case you are by the code card and they need maybe something, FE fluid or something, you should be able to know where to get it. If they need injection syringes or whatever they need, you should be able to know where it is and be able to get it to them. And that's why we all need to familiarize ourselves with it. If we have an hospital or a practice where they don't have this, it's an idea you can sell to them, because it's going to help you. It means that when there's a code, you know what to take, and then everybody goes there, and then you start giving it. But more importantly, our role as a pharmacist is to know much about all these medications. After this presentation, I will, because I know it's a lot, and I will share this presentation with everybody. I've actually sent it to Dr. Bello, and then I also sent some emergency medications and how to mix it and everything. Not all of them will be applicable, but at least we can familiarize ourselves with it. In fact, there was one that was done in form of a book. You can take that. I mean, when there's a code, we actually take that along. So if you have to mix something, you don't need to cram anything. Just open to that page, try and do whatever you need to do. But more importantly is, they need pharmacists more importantly when it comes to when you're dealing with infants and pediatrics, because their own dose is weight-based. So you want to be sure that you're very good at your calculation, you're on top speed, because it's an emergency situation, and the nurses don't want to start racking their brain. They don't want to give a wrong dose. The doctor will just tell you, give me this, and then they told me that. You are the one that's going to know, okay, give whatever doses, you're going to be the one to calculate. You know that when you're going there, you need to know the patient weight so that you can give the right medication. And more importantly, you also know that what fluid to mix it with. And when you are giving your medication to the nurse or whoever is administering it, you have to give them the flush too, because when they give it, they also need to flush, because sometimes if you give it, it can just stay by the tubes, and not everything will go into the client, and you want everything to go into the patient. So those are part of the things that may be necessary. I think this one is a lot clearer. This is another adult crash cart. In the BLS profile, there are so many, there are some predictable rhythms that is common when people are in cold blow, when they have cardiac arrest, like AFib, FTAC, PSVT, bradycardia, and stuff like that. And then the rhythm actually changes. And that's why as a pharmacist, sometimes you want to familiarize yourself with the rhythm too. You might not be an expert in it, but when you see a FTAC, you should be able to know that is a FTAC. Or when you see bradycardia, you can say, oh, that is bradycardia. And then you know which medication to use. If it's brady, you want to go for atropine. If it is FTAC, you want to go for something that will help take care of it. And those are things, but as I've said, if you practice it over and over again, you become an expert in it. And as I've said, I'm going to share this slide at the end of the presentation, and I think that will be very helpful. So the main thing is, there are so many levels of advanced life support. We have the basic one, which they believe everybody should know how to do that. In case somebody has cardiac arrest, respiratory arrest. If we forget the fact that you might even use it in the hospital, the fact that even as an individual, we can use it in our house, in our home. God forbid, if something happens, before the help comes, you can have an opportunity to at least do something, not just wait and be shouting. And that's why when you are trying to take care of the sick, we are invariably taking care of ourselves. In fact, before I became a BLS instructor, whenever I go for my certification, I always encourage my wife, please go for it. Because if I'm going to slum, most likely to be the person beside me, at least so that she can do something. It makes no sense for me to know how to do it without the person that's likely to rescue me not knowing it. So I think it's something that is good that every pharmacist should at least have the basic life support training be able to know what to do if there is need for emergency. And then apart from the basic life support, there is an advanced cardiac life support, which is a step forward. In that case, apart from knowing what to give, in that case, okay, what are the medications? Then you have to start now digging at what are the causes. Is it hypovolemia? It is hyperkalemia? Because when all those happens, while you are doing your CPR, they are drawing the labs. Maybe when the lab comes, you can say, oh, the potassium is too high or the potassium is too low. Then you know that, oh, this is the medication they will need to counter that. When you are there as pharmacists, you are preempting them. And then that's how you can be very useful. And as I've said, when you get there, if there's nobody to do compression, you'll be able to know how to do it. If there's nobody to give respiration, oxygen or something, you should be able to do it because there's no big deal there. People that are doing it also learn it. And I believe with our knowledge, with everything that we have, we should also be able to do it. And so I just gave this is a kind of part of the algorithm that will follow during code. And this, as I've said, you don't have to memorize it. For every code card, you put a copy of all these algorithm on the side. So what they're saying is, if somebody collapses, the first thing you say, you find out from, you see the person, are you okay? Are you okay? You touch them. Then you need to look for to see whether they are breathing or not. And then you also need to find out if they have pulse, because the pulse is what is going to indicate whether they're actually in code blue or not. Somebody may not be breathing out loud, but if they have pulse, you only need to give rescue breathing. But if they do not have pulse, that is when you have to start your CPR, which is very important, which is cardiopulmonary resuscitation, which is you have to give chest compression, 30 compression to 2 breaths. I know during the COVID, not everybody is comfortable giving breath. So if you don't want to give the breath, in fact, there is hand-only CPR, because it's been found out that what you are trying to do is to restore the heart and to pump the blood to the system before the organ damage starts to happen. So, but in this case, if you look at it, you start the CPR, you look at the rhythm. Is the rhythm shockable? How will you know that? When the code starts, immediately the code starts, you have to get somebody to get what you call an AED. The AED will come, you attach the AED to the patient, there's direction on how to do that. Immediately you attach to it, it will tell you whether the rhythm that is going on with the patient is shockable or not shockable. Shockable rhythm include fib or pivot. But the ones that are not shockable, like asystole, in that case, you just continue to do epinephrine, continue to check for rhythm. And then, of course, if you want to check for the rhythm, or if you want to check for the pulse, why will you check it? If it's a baby, you have to use the brachial arteries. If it is an adult, you have to use the radial or you use the carotid arteries. So those are things that we as pharmacists need to know, so at least we'll be able to apply it whenever there is need for it. And as I've said, so having said all that, by the time you do all it, by the time the patient now, let's say there's return of spontaneous circulation and the patient finally came back. Of course, when they came back, they're not going to come back to become strong. They'll still be very weak. Maybe their BP is very low. So you have to think of what medication you need to give them to increase the BP. You know, sometimes they go on what they call hypothermia protocols, that they want to bring down the temperature because the temperature is too. So there are a lot of things which, as pharmacists, we need to familiarize. Well, we may not be the one doing it, but if we know how to do it, it's definitely going to help us in becoming an active member of the team. Like I said, this is CPR is key during code blue. You need to do chest compression, at least 100 to 120 compression per minute. And you have to do that. I mean, you give 100 to 120 compression, and then you give, for every 30 compression, you give 2 breaths. Every 30 compression, you give 2 breaths. That's a cycle, and you're supposed to do like 5 cycles within 2 minutes. And then, of course, sometimes a code may take 30 minutes. You continue to do it and the patient is not responding. So, of course, the person doing it will be tired. So sometimes they will say, pharmacist, can you help us? You have to jump in and do that too. So, and that's why it's important for us. We need to look beyond just giving the medication and look at every other thing. As I've said, code can happen. It can happen to kids, it can happen to adults, it can happen to anybody. But when it happens, how do we approach it? And that's why it's important for us to know how to perform some of these functions apart from the pharmaceutical functions. And then thank God now there are so many options. There are instructor-led training, which somebody is going to stand in front of the class and train you. But there are also blended training, which you do some online and you finalize the other one in the classroom. Particularly what they do now where I work presently is you do all the didactic work online. And then there will be a few simulations. And then you now come to the mind making, like 20 minutes and just do it and you're done. And so for you to know the importance of this knowledge, it's being done every 3 months, every quarters. You have to do the CPR continuously. And so there's no way if you do it over and over again, you become an expert in it. So in conclusion, to be effective as a code, as a pharmacist, you need to understand the code process. And then you also need to understand your role as a member of the code team. And as I've said, as a member of the code team, not just pharmaceutical alone, you have to know some other things too, so that in case there's nobody to do it, to function, you'll be able to do it. Sometimes you have to multitask if there's not enough people to do that. And then, of course, you have to be very familiar with commonly used medication. Some of them can be pushed, some cannot be pushed, some need to be diluted. So the doctor will just say, give 2 milligrams of calcium chloride. It's not left for you, the pharmacist, to know whether you have to draw that as a piggyback or you draw it as a push. So if you're not familiar with it, then you can cause more damage than what is supposed to be. So, and then another way to learn about that is by making sure that you organize mock code. We do that a lot. They will stage a code and then everybody will go there. And by the time you do a mock code over and over again, you become an expert and then you'll be able to perform better when the real code comes. And of course, I use a lot of references from American Art Society and then the BLS provider manual from American Art Association, because I'm a member of the group being a BLS instructor. And they said that most jobs in the US for pharmacists now, they want you to be BLS certified, ACLS certified, or PAR certified. Or let's say you're a fresh graduate, even they actually train them when they're in school now. Before you graduate, you will have been certified in most of these things. And let's say you are not satisfied, they'll give you maybe within the first 6 months, you must be certified with all this. And I believe with all this, if we're able to do this, we're going to enhance the role of pharmacists in meeting the global health need. Code is part of the health need that pharmacists need to participate. In that case, I want to stop here and thank you very much for the opportunity. And I'll look forward to questions at the end of the program. Thank you very much.
We want to sincerely appreciate Dr. Raji for this very insightful lecture, or let me say teaching, a teacher now, because it's very obvious that BLS is certification is the way to go, whether you are a pharmacist in the emergency room or you are the pharmacist in the community. This training is very essential for us. It will equip us for better practice. I want to say thank you very much again, sir. I'm very sure that questions will be awaiting you at the end of the program. Please, so hang around. Thank you so much. Before we call the next speaker, we want to invite the chairman of the Kwara State PSN to quickly give his welcome address. Pharmacist Abdul Malik Muhammad Baba, Merit Award winner. Malik, please unmute yourself and take the podium. Hello, Malik. Malik, are you there? Just click on mute.
Okay. Okay. Yes.
All right. You're welcome. Please, you can go ahead. Your opening remarks.
Hello.
Yes.
Hello.
We are hearing you.
All right. Good afternoon, everyone. I want to sincerely appreciate the coordinator of the West African Postgraduate College of Pharmacists, Kwara Kogi Zone, Dr. Ibrahim Bello, for putting up this program, collaboration with the Pharmaceutical Society of Nigeria, Kwara State. It's indeed a very, very good one. And in fact, let me also use this opportunity to apologize for coming in late. You know, we had a lot of programs lined up today, so jumping from one place to the other. So I want to say Happy World Pharmacists Day to everyone here present. Following the theme of today's celebration, which is meeting global health needs. It is a very, very good one. You know, last year it was strengthening health systems. You know, after the pandemic, the COVID-19 pandemic, a lot of things have happened all around the world. And with the way it is now, we are moving forward. And that is the more reason why you can see that the theme for this year is meeting global health needs. On the basic life support, of course, you should know that in the past, during the last administration, we had training for pharmacists in Kwara. And I think with the trend, it's better now that we train more pharmacists in Kwara to be certified as basic life support providers. In fact, I was a member of the national medical team to Saudi Arabia this year, and it was a major prerequisite for you to be a participant as a member of the medical team. I had to quickly go online to check for a class, which I enrolled myself in to get certified as a basic life support provider. So I have my certificate for that also. So I would encourage other pharmacists in Kwara to do that too. So as we continue with the program today, I believe we all have a lot to learn from our teachers here, because everybody here is going to present have so many things to teach us. So once again, I want to welcome you all and congratulate everyone here. Say Happy World Pharmacists Day 2024. Thank you very much.
Very much, Chairman, Pharmaceutical Society of Nigeria, Kwara State Branch, for that warm welcome address. We appreciate your coming. Please stick with us to the end of the program. Straight away,
yes,
we'll go to the second presentation. This is going to be another very interesting one. It's Medicine and Pharmacy of the Future, the UK Pharmacy First Initiative. This topic is going to be handled by pharmacist Sherifat Muhammad Kamal. She is a specialist pharmacist and a community pharmacy manager with over 20 years of experience in pharmacy practice. She leads and volunteers with organizations and institutions, and she contributes to initiatives, to policies, and strategies through her roles, clinical leads, health promotions, and medication management. Pharmacist Sherifat is a mentor with RPS. She was a school governor and ex-vice president of PDA BAME network. She's a council member of the British Islamic Medical Association, and she was recently awarded a fellowship of the Royal Pharmaceutical Society. We congratulate you, Madam, for this great stride, the United Kingdom, for her contributions to pharmacy practice. Pharmacist Sherifat is married to Mohammed Adeneyi Kamardin Al-Adabi and is blessed with children. Please join me to welcome her as she takes the podium to take us through the second presentation in the next 15 minutes. Madam, we are happy to have you here.
Thank you.
Yes, you can share your slides.
Yeah, I'm going to talk through and just slide. Good afternoon, everyone. And I am blessed to be here again. And all protocols observed, the presidents, the head, the leads, our fathers that are on ground, my seniors that are here. I say good afternoon and welcome everyone to this beautiful occasion and beautiful topics. I'll say I started my career from University of London Teaching Hospital, and you can see mentors here, Dr. Busola, Mr. Bello, everybody are here. And in United Kingdom here, from the topic that I wanted to speak about, I think with the future of pharmacy practice, it's everything that we are all working towards. The predecessor speaker talked a lot about developing our roles in different perspectives. And when we look into the future of pharmacy, we wanted our younger pharmacists to learn. We wanted them to pick up, we wanted them to be happy about what they do. We have clinical pharmacists now, we have oncology pharmacists, we have pharmacy in different perspectives. And the reason why I wanted to speak more about the future of pharmacies and the Pharmacy First initiative is how we can incorporate our community pharmacy into everything that we have as clinical pharmacies, as oncology pharmacy, whatever pharmacy specialty that we find ourselves in. And as my sister has introduced myself, I started as a clinical pharmacist with University of London Teaching Hospital. Then I went on to be a pharmacy manager with Boots for over 10 years. Then I went into hospital again to specialize as an HIV and sexual health pharmacist. Then I then specialized in clinical lead for vaccination. Then I was one of the clinical lead for COVID vaccination in United Kingdom. And currently I work as a pharmacy manager, as a consultant pharmacy in a long chain pharmacy practice. So what are we talking about the Pharmacy First? The Pharmacy First initiative is launched early this year. And what this has done in UK is to make use of the clinical skills of pharmacy within the pharmacy, within the community pharmacy. In Nigeria, people just walk in by tell the pharmacist, I have this, and the pharmacy will just recommend and they can buy and go away. But the UK pharmacy scheme is more of a referral system from the clinical teams, either in the hospital or in the community team, where the doctors can refer a patient to the pharmacy for minor ailments that they can normally get within the community pharmacies. We know that people just have headache, they come into the hospital, or they might have just minor, just earache, or sometimes just UTI, and they just pop into the hospital. What the Pharmacy First scheme has done is that they have picked about 1, 2, 3, 4, 5, 6, 7 conditions that can be managed within the community pharmacist. And so once these conditions go to the doctors, they will refer the patient to go to the pharmacist first. And this is why it's called Pharmacy First. Once they get to the pharmacist has some PGD, antibiotics, medication that they can recommend to and prescribe to that particular patient. Before they can even, if they need to signpost, they can recommend them back to their GP practice. So we have the UTIs, we have sore throat, we have sinusitis, we have earache, we have shingles, we have infected bite. Most of these treatments can be done within the community pharmacy. I know in Nigeria, we already do this, but we still at the same time do it within the doctors. So this is another open way for us at home that we can tell our doctors, rather than treating earache, shingles, infected bite within the hospital system, they can send this to the community pharmacy, whereby the pharmacists, the patients can know the importance of our community pharmacy within our community practice. Another thing that this Pharmacy First serves an essential aspect of primary care recovery plan. When we look at our hospital, it's always overbooked, or we have people just in there with so many ailments that can easily be treated within the community pharmacies. And we have our community pharmacy nowadays that are well equipped. Some of our community pharmacies have accreditation in so many specialties, where we have all of our patients going into hospital all of the time, that is reducing the capabilities of our community pharmacists to be able to expatiate what they can do. So one of the reasons why this is important is for us to be able to signpost, educate our doctors that occasionally they should signpost our patients to the community pharmacists. So what are the benefits of this to our patients? They don't need the doctor's appointment. They just need to walk in. They don't need to see a consultant because the pharmacists will eventually refer them to the consultants or the doctors if need be. And also, another thing here is that this is a free treatment here. But even the advice in community pharmacy is free as well, even in Nigeria, when our patients go to see the doctors. And the convenience, extended primary pharmacy hours. Sometimes it is late in the night, the patient can easily walk into the nearest pharmacist, complain about whatever is wrong with them, and the pharmacist will get them treated. And even some of the doctors, when people come into them, they just come, I have headache. And it might be just something minute that pharmacy can get treated. So it's high time we work together with other healthcare professionals to signpost people to community pharmacies so that we can make use of the specialties we have with our community pharmacy experts. Some of them are clinical lead, they are oncology lead, they have specialties in cardiology as well. Most of our pharmacists that work in community pharmacies are. So when they need to signpost, they know when to refer. So this is one of the things that we gain from the for Pharmacy First in United Kingdom. And I think it's something we can easily achieve at home as well. And for our doctors, what are the things that how can this support our doctors? Shift minor ailments. So our doctors are not supposed to be treating minor ailments. Some people will have a cut, just a cut, and they go into the doctors. And if they go to the community pharmacy, there's some things that the community pharmacy can do for them. And if they need to be referred, the community pharmacy automatically refer them to doctors, especially when they need to take tetanus vaccines. Then is doctors' congestion in hospitals, clinics, and centers. We know that all hospitals are congested at the moment. So the high time we have a meeting or we have a congregation of experts, healthcare professionals come together and highlight how important the role of community pharmacy is to our doctors so that they can do minor referrals. There's so many things that can be treated within community pharmacies. And we know our pharmacies are well equipped to know when to send to the doctors, to know when to send to A&E, to know when to send to consultants. All of these little things are the things that we need to work together with our doctors and hospitals to know when to refer. Tell patients to go to the community pharmacy first before they come to the hospitals, so that they know how important and how equipped our pharmacists in community pharmacies are. Also, in our community pharmacies, if we continue to refer patients to them, it enhances their role and recognition within the community. And also it increases the community pharmacy visibility and their impact within the community and healthcare system. The patient, we now know that we don't only sit in the hospital. We don't just sit at the back of the counter in the hospital. Even within the community, we have the same pharmacy that can support patients with their minor ailments and things that need to be treated first. Then it increased patient engagement. In the hospital, the engagement is a bit low, but in community pharmacies, patients can go in, ask time, want to speak to the pharmacy, they take them to the consultation room, they chat with them, ask for the medication they're using, look for interactions, and see how they can help them. So all of these are roles that can be taken within the community pharmacy services, as well as most of the things that we do within the hospital system. Another thing that is an advantage to community pharmacy is participation in income support. It increased the revenue generation for our community pharmacies. So once we refer more patients to them, the community pharmacy can expand. They can train their staff, the pharmacy assistant, their dispensers, to make a lot of inquiries on the questions they have asked their patients, on what they do, what they take, and they can help the pharmacists to do their own work as well. This will also increase career development for our pharmacy assistants as well. They will know more on how to speak to patient. They know more about clinical state of the patient as well, and they will be able to ask relevant questions when patient comes into them. And this again, we reduce the workload we have within the hospitals as well. And professional development for our community pharmacists. Once we are expanding the role within the community pharmacists in clinical stage, in managing minor ailments, our pharmacists, we have expanded role within community pharmacists. So we can have 2 pharmacists within the community pharmacists. Once we have the patient, we have the experts, and at the same time, we can treat and we can refer when we need to into the hospital system. And also for the NHS hospital and healthcare systems, even in our hospital, maybe University of Ilorin Teaching Hospital or the General Hospital, we can save cost. If we have billions of patients coming in daily, and sometimes it is improbably too much, the queue to collect medication, or the queue to see the doctors, or the queue to see the patient is waiting just because my child has earache and they want to see a doctor. Whereas we have some community pharmacists that are trained to look into the hair to be able to take care of the patient. All of this will reduce the cost within the hospital, and we'll be able to use more efficiently the capacity of our pharmacy that stay in the community. Then efficient access to healthcare. So patient can, instead of waiting, I have not been able to get to the doctors, I don't have appointment, they can just walk in to see maybe one of our pharmacists in the community, and the pharmacy will know if I need to refer them or not. It's also relief pressure on urgent and emergency care. Not everybody goes into emergency care. Once you know that, once you are able to go past the first stage from the community pharmacy and you're not being referred, it will reduce that congestion within the hospital, and we'll be able to take the workload out of the hospital, and our pharmacists, with clinical experts within there, will be able to support our patient. So what is my call to action? And today, our call to action is that all pharmacists are trained to contribute their own strength into the future of pharmacy, whichever area you are. If you are in the hospital, you should be able to refer patients if they need to go into the community pharmacy to see the pharmacy in the community. If you are a specialist within any area within the hospital, you should be able to speak to your clinicians or doctors, specialties, to refer and let patients know that they have expert pharmacists in the community pharmacy that can help them fast before they can come to this hospital. And at the same time, we should be able to train ourselves to get ourselves equipped in so many areas. Just like my co-speaker has said, we should train ourselves to know how to do basic clinical skills. Maybe how to look at the ear, how to treat the ear aches, how to manage sore throat, how to use the otoscopes, how to look at how to treat shingles, how to treat infected bites. Sort of those clinical minor ailments, we should learn to develop skills, go into trainings, look to create training modules within the community pharmacy setups, and where they are accredited to be able to take up so many clinical scopes within the community pharmacy. All of these are the future of pharmacy practice. In UK now, we're being trained to be independent prescribers. Some of our independent prescribers in the community pharmacy can prescribe minor ailments. They can prescribe repeat medications. They can manage patients in different areas. They can manage some asthma patients. They can manage some patients that are on different specialties that they are trained and capable to be able to do. So these are the skills that we have to develop as pharmacists for the future, as well as supporting our patient. At the same time, we'll be supporting ourselves, and at the same time, we'll be supporting our community. I know there might be some other questions from my colleagues on the platform, but I will say thank you for giving me the opportunity to go through this, and thank you for organizing this very, very important talk. Specifically, I'm just passionate about the future of pharmacy and the pharmacists to come in future. I hope this is going to help us to develop ourselves, and it's going to help us to highlight and expand the scope of our healthcare practice. And I wish everybody and all in all our duties as pharmacy. And I congratulate all of us. Happy World Pharmacy Days. Have a lovely day. Thank you.
We want to sincerely appreciate you, Pharmacist Sherifat Kamal, for the presentation. Of course, you have shown us the way forward, the future of pharmacy practice. And the UK Pharmacy First initiative, of course, is been in practice in Nigeria, even though it's not a policy. Most of our patients, they go to the community pharmacy first before going to the hospital. And of course, Pharmacy First initiative has a lot of advantages. It presents advantages to the patient, to the health system, and to the society. And that means that community pharmacists, we have to be well equipped, and the future is bright. Of course, it brings more money to our pocket. Thank you so much. We appreciate you. Please, we want the participants, our audience, to please write down their questions for Pharmacist Sherifat, and we can also put them on the platform in case you feel that you will forget. While the presentations were going on, so many of our senior colleagues are pharmacists from all over Nigeria and the outside Nigeria, in diaspora, they joined the platform. And in no particular order, we want to quickly recognize the following people. We want to welcome our fellow Mrs. Kolawole Falilat, FPSN, Pharmacist Alege Eho, FPSN, Pharmacist Mrs. Aduke Kuranga, FPSN. We appreciate the presence of Pharmacist Fatima Bola Mustafa, Pharmacist Adejuwon Telaja from the diaspora, the former immediate past chairman of Kwara State PSN. We recognize you and we appreciate you for joining in the celebration here in Nigeria. We also appreciate Pharmacist Hafsat Adeshina. We welcome Dr. Mrs. Felicia Williams. We also want to sincerely appreciate the presence of Pharmacist Susan Ayetoro. Incidentally, Pharmacist Susan was the immediate past zonal coordinator of the WAPC Kwara Kogi zone. We welcome you, Ma. We thank you for joining us. We also appreciate Dr. Adiola Mustafa. Yes, we also see on the platform Dr. Ologe. We also appreciate SPOG Idoj. And then we recognize Pharmacist Lovett Oladele, Pharmacist Ronke Shaw, Dr. Joseph Ole, Pharmacist Olaide Adebayo from the US. And other people will recognize you as we take note of your presence. We appreciate you, everybody, for being on the platform. Thank you so much. We're going to take the last presentation now. And that presentation is also equally very, I'm looking forward to this presentation, Pharmacy Beyond Borders. Wow, embracing global best practices for enhanced patient care in Nigeria. And to handle this topic is no other person than Dr. Mutiat Olubukola Olulawal. Dr. Olulawal is a consultant clinical pharmacist, a public health advocate. She's a holder of PharmD degree, a fellow of the West African Postgraduate College of Pharmacists, and she is currently advancing her expertise through a PhD in pharmacy administration. Our professional journey started our internship and then NYC in Abuja as the deputy director and head of department at the State Specialist Hospital, Osogbo. Our individual achievements include winning the prestigious PSN Biogenerics Integrity Award in 2021 and the Pfizer Excellence Award in 2022. At the FIP of 2023, she made history by securing the Maiden FIP HPS Grant Award for her research on pharmaceutical care interventions. She is the National Secretary of the Clinical Pharmacists Association of Nigeria, CPAN. She's an adjunct lecturer and preceptor at Obafemi Awolowo University, Ile-Ife, and the WAPC.
In progress.
She is an avid researcher with several publications to her credit. Her personal life, she said, is enriched by her marriage to Oluyide Olulawal and the joy of raising 3 daughters who inspire her continued pursuit of excellence. I'm very proud to present to you this afternoon Dr. Mutiat Olulawal. She's going to be speaking the next 15 minutes on pharmacy beyond borders. Please join me in welcoming her. Madam, you can take the podium.
Okay, thank you, moderator. Good afternoon, everyone. Trust we've had a very wonderful session so far. In fact, I've learned, relearned, and unlearned. So I just want to hope that this, my presentation, will still toe the same line, seeing that my co-speakers are really set the bar very high. So, permission to share my slide.
You have the permission. You're a host.
Okay. My topic, as has been said, is Pharmacists Beyond Borders, embracing global best practices for enhanced patient care in Nigeria. According to WHO, they said health consists of 6 building blocks. And the second one of these building blocks is access to essential medicine, vaccines, and commodities. And for those of us who are not Gen Z, we'll remember a former Minister of Health in Nigeria that said hospitals without drugs are mere consulting clinics. That is to underscore how important the pharmacy profession is.
Yes, can you put the slideshow, please? Slideshow, yeah.
Can I work? It's not showing yet.
It's showing now. It's okay now.
Okay. So I can continue.
Only go ahead.
So that's my content. I'll be taking you through introduction, the global pharmacy landscape. We look at how it has been. We have all listened to the 2 previous speakers. They've been able to paint a picture of what is happening on the global world, on the global scale, which we all know is like the ideal one. But sorry to burst your bubble, I'll be taking us through the reality, what is on ground in Nigeria presently, and together maybe we'll attempt to make that journey from reality to the ideal. What do we need to do to get there? So, introduction. Pharmacy practice in Nigeria serves as a cornerstone of the nation's healthcare system. Here, mostly, in many places, hospitals especially, pharmacists are understaffed. I'm speaking from my state hospital in Osun State, Nigeria, and it will interest you to know that there are only 2 pharmacists in this hospital, and we are like a 150-bed hospital, only 2 pharmacists. We rely on the interns, on the corpers, and of course, places you have sometimes poorly equipped environments too. The new trend now is that even in the industry, they are relying more on non-pharmacists to save costs, which is a case of maybe Kobo-wise Naira foolish at the end. So the relationship between pharmacists and patients has seen as transactional. What do I mean by that? There is this thing in pharmacy profession, the merchant professional dichotomy. Sister Sherifat in her presentation mentioned it, that people can walk into the pharmacy and say, I want to buy this. Yeah, they can come in and say, give me 2 capsules of Ampiclos. You want to know, but sometimes they are like, I want to buy, I'm giving you the money. So there is this merchant professional conflict. There is inadequate knowledge also about the roles of pharmacists in healthcare delivery. The public is not yet aware of what exactly we can do. There is this conflict in the way they view us. And in places too, sometimes you get to a hospital, you meet the pharmacist pre-packing. When pharmacists now have to start counting 1, 2, 3 tablets, then you're wondering that, is it all those years in pharmacy school? Was it just to count tablets? Added to this, we have our people now resorting to the use of alternative medicine practice, using herbal products. So what's the situation at the global scale? What's the situation on the global scale? Fortunately, the other speakers have been able to take us through some of this one. There is increased professional development, there is specialization so that they can do so many things. We hear about some states being granted private rights abroad. There are lots of collaboration going on. There is vaccination rights. They are leveraging on the use of technology, the growth of telepharmacy, and the others. So now let's come back to Nigeria. What are our own challenges here? I start from access. There is not enough access to medicine. And we know that normally when we talk about access, we are talking of both availability and affordability. Let's say a drug is there on the shelf, of course it is available. But if you cannot pay for it, and in this climate, many of the purchases is out of pocket, mostly. So if a patient cannot afford it at that point in time, then the access is still not there, because to that particular patient, it is not really available. So that is one challenge. Then we also have regulatory challenges. Nigeria is a very wide country where we are always, it's not as if we are the largest country or whatever, but regulation, they usually have problems. The regulatory bodies, they have challenges with regulation and enforcement of laws. Then we also have inadequate funding and remuneration, and this one is a serious problem because funding for this year, the funding for health was 4.6%, which was even a further reduction from the 5.75% that we had last year. And this will be a double-barreled approach now, because already things are more expensive than they had last year. You have to pay more for drugs, and now they are reducing the funding, and this will affect the remuneration of people, of pharmacists in government. It will also lead to poor motivation for pharmacists. Then inadequate infrastructure. I don't know which of our sectors has enough infrastructure. The infrastructures are not there. I move on to trained pharmacists. We don't have enough pharmacists. WHO recommends 1 pharmacist to 2,000. But currently, what the PCN, the Pharmacist Council of Nigeria, told us last, that we have 1 pharmacist to about 13,000 population. So 1 to 13,000 instead of 1 to 2,000. Unfortunately, the number of pharmacists that we have has been recently reduced further due to the Japa syndrome. So everybody is like on the way out. So that is weakening the system further. The nature of training offered by pharmacy schools. The nature of training offered by pharmacy schools, though very good, we have been able to churn out world-class pharmacists, but at the same time, to meet up with the current trend, that training will have to be aligned to meet up. We have the next one is what I call the elephant in the room. That is the internal strife and the enemy within. The internal strife and the enemy within, it has to do with what we call pull him or her down syndrome, shortened form of another PhD. It is quite common in some places. I will get back to it when I get to the solution. Inadequate soft skills. We know we learn the technical skills in school, but some of our challenges is because we are not good enough at these soft skills, and you will see why shortly. So the global pharmacy best practices currently globally, they are adopting international standards in pharmacy training and education, which is making the global world to turn out pharmacists that are doing wonderful things. So many things, the education, the training. Then they are collaborating with global pharmacy organizations, even other international organizations, FIP, WHO. We have specialized pharmacists that have specialized, just like the two that just finished speaking with us. They are implementing evidence-based practices. Just in this FIP that ended, I was able to meet so many pharmacists that what they are doing. At a point, I called them, I said, am I a pharmacist? Because you look at it and they have been able to do so many things. It's not as if we are not doing anything, but the truth is we are not doing enough. The global world, they've been able to leverage on technology to do so many things. This, of course, we'll have to be playing catch up in this. Just before now, the lights went off. So when you don't have some things in place, there's a level at which you can leverage on technology. So going forward, I've been able to tell us the problems now. So what are the solutions? The first one I said is developing the right mindset. What do I mean by that? Developing the right mindset. We need to first tell ourselves that we are ready to walk the talk and mean it. We need to tell ourselves that we are ready to walk the talk and we mean it. Because if you don't do that, if you don't first tell ourselves that there is a problem that needs to be solved, then that's when we can now start looking at, okay, what are the solutions that we can use to solve this problem? But we must first admit that there is a problem, there is a gap between us and the developed world, and we are talking of pharmacists beyond borders. We want a situation where what I'm doing in Nigeria is what Dr. Raji is doing over there in the US, or what Sister Sharifa is doing over there in the UK. So we want something across board. If we have to do that, then we should develop the right mindset for it. The second thing I said is love one another. We can start wondering that what is love doing in this presentation, but it is very important. We need to love ourselves genuinely. We must join hands, as it is in our slogan in PSN, as men of honor, we join hands. So if we now find it difficult to do that, then we must at least love the profession. We must at least love the profession. If we genuinely love the profession now, we won't be putting obstacles on one another's way. Even if we don't like ourselves, we'll be able to look at the bigger picture and be able to do what is right by pharmacy. We cannot continue to be our own worst enemies. We have enough enemies outside there. In Nigeria, there is a serious problem with charlatans. They have taken over the whole landscape. And if we have to move pharmacy forward, we must join hands and be able to chase them to the background. So continuous education and specialization. Continuous education, we should get to a stage that stopping at B.Pharm, the first degree, is going to be an exception and not the norm. It's going to be an exception and not the norm. People should be able to upskill, to update knowledge regularly, because it is when you do this that you can be able to contribute to your quota effectively. For those of us in the hospitals, further education will always get you a place at the table. If you are not there, they will keep it for you, because they know once you come in, you are going to give them solutions to the problem. In what round they will call you and let you be there before they start. Then specialization of pharmacists. Of course, when you have continuous education, then you have people specializing into various fields. Fortunately, the West Africa Postgraduate College of Pharmacists, the WAPCP, they are already doing it. They have some specialty, the critical care, infectious diseases. the cardiovascular, endocrine, renal, and the rest. And the Clinical Pharmacists Association of Nigeria now has 15 specialty groups. All this serves to make sure that pharmacists contribute their quota in the healthcare system. Then we have to align our training with global trends. We should be able to produce pharmacists that can do modern things. We don't want pharmacists that will just be dispensing 2-3 times. We want pharmacists that will be able to go into research and do wonders. Doing this, we have to invest in capacity, training and continuous training, partnering with global organizations. Fortunately, PSN has some partnership with the FIP. They've been at it for years, but we should be able to leverage more on this. There are opportunities. I first heard of PharmaBridge was it during the FIP. There are things that you can do at no cost that will improve our knowledge and skills. Then we must find a way of integrating technology. Dr. Bello has been doing wonderfully well in this. Then there should be collaboration. No profession is an island. There is no professional that can do it alone in the health sector. We all need ourselves. And in this collaboration now, we now need lots of what I call soft skills. What are soft skills? We already know hard skills, the technical skills that we learn in school. But when you now talk of soft skills, these are necessary to navigate our way, especially in the hospital as we talk about moving from behind the counter into the wards. You need to know the right amount, the right kind of words to use. You need to have negotiating skills. There are things they will bring into the hospital that they will not want to give you. Pharmacy is mostly, is always like an afterthought. We have to be proactive. We have to be steps ahead of them. Our emotional intelligence must be top-notch. All these are soft skills, and it must be taught in school. Leadership skills. They should infuse in us the right amount of confidence that will be like, no, I'm a pharmacist. I can stand my ground. I'm an expert on drugs. Then advocacy. We need this. We need lots of advocacy. If you are doing things and you are not letting people know that this thing I'm doing, then it's just like winking in the dark. We have to make the right kind of noises in the right places. Let them know pharmacy, this is what we are doing. We should go into research. At a point in time in our hospital, we did prescription auditing. There was another time we did pharmaceutical care interventions that were able to bring down prescription and tell them that so percentage of prescriptions in this hospital as drug therapeutic, they have errors. So DTP, drug therapy problems. We were able to list it out to them, and by the time they saw it, they were like, oh no, then you need more staff in the pharmacy, you need this.
Hello, Dr. Mutiat. Hello, Dr. Mutiat. It seems we can't get Dr. Mutiat now, but she's still here. Okay. I think our network is having issues.
In closing, zones for organizing this. I thank Dr. Bello for counting me worthy to present this, even though I'm being sandwiched between two very eminent pharmacists, but I hope I've been able to contribute to the discussion. Thank you.
Please, let's appreciate Dr. Mutiat. Yes, with a round of applause and our comments on the platform. And Dr. Mutiat, you are not being sandwiched. You are a global entity, and you know yourself. We appreciate you so much. for the presentation. Sincerely, our reality looks scary to global best practices and the way forward. Nigerian pharmacists are well able, and with continuous education and specialization, I believe we'll get there. Thank you so much once again for the presentation. It is now time for question and answer session. And please, if you are interested in asking questions, please can you just indicate with a raise of hand? And please, we still employ all our participants to be muted for now until you are called. Thank you very much for being very attentive. Please, Andre. Questions? Or rather, let me say, if you have any questions for the speakers, please can you unmute yourself and ask your question?
No.
Any question, please? There's a new message. Okay, so all our presenters have been appreciated. We have a comment. Thank you, Fam Sherifat, Kamar, Ilorin Emirate, for this honor and beautiful presentation. We are proud of you. My sister Famolaide Adebayo, your presence is highly appreciated. Well done to our 3 lecturers, moderator, coordinators, and congratulations to all participants and pharmacists. Thanks so much, Dr. Mutiat, for your presentation. Well presented. Thanks, Dr. Olulawal. Well done, Famutiat and coordinators. Good job to our presenters, Dr. Raji, Dr. Sherifat, and Dr. Mutiat. I think that the presentations have been fantastic and they have given us food for thought. For the hospital pharmacists, for the community pharmacists, and for every pharmacist in Nigeria, including those in the academics and industry. We all have roles to play to ensure that the theme for this year's World Pharmacists Day become a reality in our practices. At this time, I want to call to the podium pharmacist Dr. Ike Bello, the zonal coordinator of the WAPC Kwara Kogi zone, to give his closing remarks, while our mother, the immediate past coordinator of the zone, pharmacist Olushola Ayetoro Susan, to give the closing prayer.
In the name of Allah, the most beneficent, the most merciful, we give thanks to God Almighty for making this webinar a great success. And as we draw this impactful webinar to a close, on behalf of the West African Postgraduate College of Pharmacists, Kwara Kogi Zone, and the PSN Kwara State, I extend my heartfelt gratitude to all our speakers from within and outside the country, our amiable moderator, our respected participants, especially those joining us from the various regions across Nigeria and beyond. Today, we have looked into critical topics that underscore the theme of this year's World Pharmacists Day, Pharmacists Meeting Global Needs, with sub-themes. Number 1, the pharmacist's role in Code Blue. Number 2, medicine and pharmacy of the future. the UK Pharmacy Force Initiative, and lastly, Pharmacy Beyond Borders, embracing global best practices for enhanced patient care in the country. The insights shared today are a testament to our role as healthcare providers, dedicated to improving health outcomes globally and locally. As we leave this event, let us carry forward the ideas and knowledge gained, using them to strengthen our practice, improve collaboration, and drive positive change in our various areas. Thank you for your time, attentions, and dedication to the provision of pharmacy. We look forward to seeing the collective impact we will continue to make in our various practices. Once again, thank you and God bless you all.
Thank you very much. Pharmacist Ayetoro. Hello? Is she still there?
Hello.
Welcome, ma. We want you to take the closing prayer.
Okay. First of all, I want to really appreciate our guest speakers. We thank you for the honor, and we bless God for your lives. We are proud of all of you. Wherever you are practicing, we know you are representing Nigerians, pharmacists. We thank you and we love you. Father, we thank you for this day. We thank you because we are part of the people that are celebrating World Pharmacists Day. We bless God for our profession. We thank you for how far you have taken us in this profession. And we pray that God Almighty, you will strengthen us more and more in Jesus' name. We pray for all our speakers, wherever they are practicing, they will continue to grow mighty. They will continue to be relevant in the name of Jesus. Thank you for all the pharmacists in Kwara State. Thank you for the pharmacists in Nigeria. And thank you for the pharmacists all over the world. Father, we thank you. In Jesus' mighty name we have prayed. Amen.
Amen. Thank you, ma. Once again, we say thank you to Dr. Raji. Thank you for finding time to attend and prepare for this webinar. We are going to call you very soon because we need the Code Blue training. We also want to appreciate pharmacist Sherifat Kamardin. We appreciate you for your time. We thank you so much for the presentation, and we pray that God will continue to increase you. We appreciate Dr. Olulawa for the presentation. Thank you so much for your time. And at this moment, we want to say thank you, everybody, and we wish you happy World Pharmacists Day celebration. See you next year, 2025.
The slides and the link to the video recording of this will be shared all over the world. So look out for them. Thank you so much, and God bless you.
God bless.
Okay, at the end of